There it is.
I gotta get myself together for that. Goodness gracious.
Hey guys, Dr. Clerge, your DMV chiropractor, and I'm here today with Alan.
How you doing today?
All right, Alan, I'm doing good. So, you said that you saw us on YouTube, you saw us on Instagram, and you've been to a chiropractor before in the past, but for some reason you weren't satisfied. You know, what happened with
Well, what it is with that chiropractor at that time, what they ended up doing was like they just went ahead and went through the procedure, and then just took your money and then sent you home without even stretching.
All right.
So I just, got tired of wasting my money.
I see. So you wanted to try different technique, different protocols, I guess.
Correct.
All right. So most of your issues you're having, basically, you told me basically the whole thing: neck, upper back, lower back.
Correct.
You even complain of stiffness in the neck. Sometimes it give you headaches, right? So more like that tension, headaches in the back of the head.
And on the side.
And on the side. Okay. So that stiffness in the neck, how long has that been going on? Like what's?
Maybe roughly around about 3 months.
3 months or so.
And I try to pull it or stretch it.
Right, but
and when you pull it, it tightens right back up. It's not pulling to like loosen it.
I see. You can't really get it where you want it to be, basically. And you said the lower back right now is not too bad, but from time to time you feel that tightness and soreness and pain, depending tightness, on what you do.
The soreness, the pains, and sometimes it has like those little pops.
That's right.
Little cricks in your back. I
got you.
That's how I feel.
And you also own your own company, right? You're a trucking company?
Yeah.
Are you on Instagram also?
No, not yet. I'm creating my website,
you create your website
and everything, but I partnered up with another partner.
So when you get that information, let me know. And then we'll add it to your link on YouTube, okay?
No problem.
That way, if any folks in the area need your services, they can contact you, okay? All right, so, you've seen the videos before, so what I'm going to do is assess your movements, because we're focused on motion, creating motion, making you mobile, especially we want to basically create joint mobility, okay? So I want to see what's locked up, and then based on that, I'll know what to do. All right, so with that said, let's assess your head and neck movement first, okay? So what I'll have you do is just look down for me. How's that? Is that okay?
That's as far as I can go.
That's as far as you can go?
I can feel the pressure on my left side.
This side right here?
Correct.
So if I push, that's a bit uncomfortable?
It's stretching.
It's stretching, gotcha. Let's have you go back for me. So extend. That's a bit tight as well?
Not on my left, not on my right.
On your right. So when you extend, it's tighter on the right side. Okay, let's have you go side to side. So to the right. That's tight? Yeah, because you're not moving as much. Like your motion stops at this point.
Right.
Okay, let's rotate. So let's have you go to the right. Let's have you go to the left. Okay, so definitely we need to create more motion with those cervical movements. Now, let me have you look back, rotate, and stay in that position for me.
Turn to my left or my right?
You can, whichever one you prefer. Okay, and stop and hold that position. Come back to the normal position. Any dizziness, blurred vision, or anything like that with that motion? No?
No.
Okay, all right. I'm going to apply pressure to your head and neck. How's that? That's not too bad? Pressure. How's that?
A little bit, I feel it.
A little bit, okay. And pressure.
I feel it on my left.
On the left side. Okay. So the left, a lot of tightness and tenderness in that area. So let me palpate that trapezius muscle, rhomboid. Is that uncomfortable what I'm doing or not too bad? Not too bad? Okay. All right, let me have you come up for me. what I'll have you do is I'll have you bend, try and touch both feet, and let me know how you feel with that. Okay, how's that motion?
It's pulling.
You feel the pull in that lower back?
Mm-hmm, lower and mid back.
Gotcha. Just have you extend so you're going back. How's that motion?
It's tight.
That's tight?
Mm-hmm.
Okay, let me have, okay, you actually can stay in that direction. Let's have you put both arms up. Have you rotate right and rotate left for me. How's that?
That's fine.
That's fine?
Mm-hmm.
So let's have you laterally flex. So you are going to the right and you're going to the left. Okay, how's that?
I'm sorry, I don't feel anything.
You don't feel no pain or anything like that, right? Okay. All right, let's have you face down. So you'll be on your stomach. I'm going to apply some pressure in that lower part of the back. And what I want you to do is lift this whole leg off the table and let me know if that creates any pain, discomfort, anything.
It's pain.
Pain. Okay, let's have you go to the other side. Same thing. Lift that whole leg off the table. Bring it down. How was that?
You feel it pop?
Okay, you feel some popping with that motion? Okay. All right, come up for. All right, let's have you on your back. Okay. I'm going to lift this leg. Let me know if you feel any pain in the lower back. Keep the leg straight for me. That's fine? Okay. Same thing with this side. We're lifting this leg up. Do you feel any pain or anything like that with that motion? No? Okay. Alright. Alright, let's have you come up. Okay, now I'm going to palpate mid and lower back area, okay? If you feel any tightness, soreness, you let me know, okay?
Mm-hmm.
Okay. Alright, now I want to feel the motion, especially with rotation of that lumbar spine. So let me have you rotate for me. Rotate again. Okay. Alright, let's go up, mid back. Let's do that rotation again for me. This time, let's actually, let me have you come back. Okay. Let's rotate again. Come back. Okay, how's that? Is that a bit tight or is it?
A little bit tight.
A little bit tight? Okay. Alright, so what we're going to do is stretch you out first, okay? Mm-hmm. After all the stretching, we want to increase your muscle flexibility, get you all loosened up, okay? Mm-hmm. Once we've done that, then we'll start the adjustments, alright? Okay. So the first one is this is a very common stretch that I do for your piriformis area. It also gets that lower part of the lumbar, the SI joint area as well, okay? Mm-hmm. So this leg is actually coming up. Now, the key is to relax as much as you can. You'll feel tight, because do you stretch often?
No.
Not really.
You're supposed to.
You're supposed to, right. Alright, so as soon as you feel the tightness, let me know. That way I know how far I can go, okay?
Right there.
Right there?
Mm-hmm.
Oh, wow, okay. So I'm going to hold on to your hip. That way if you're tensing up, I can feel it.
But I feel it pulling my hamstring.
You feel it in your hamstring too? Yeah, because the leg is straight. Yeah.
Mm-hmm.
So we'll do that stretch and then we'll bend the leg to focus more on that lumbar, okay?
Okay.
Alright, so let's go across. Take a deep breath for me. Blow it out. You okay?
Mm-hmm.
One more time. Deep breath. Blow it out. Good. Let's do that again. And blow it out. Okay, feel you're tensing up a bit.
Mm-hmm.
That's tight?
Mm-hmm.
Okay. Alright. And let's rest this leg. So now I'm going to bend the leg. That way we'll take your hamstring out the equation.
Mm-hmm.
So we're focusing mainly on that lumbar, piriformis, and SI joint region, okay? Let me have you move your body towards this side a little bit. Perfect. Cross your arms like this. Yep. And this leg is coming up. Take a deep breath for me. Blow it out. And relax, 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 relax. Good. Again, deep breath. Blow it out. Relax. You're tensing up. Relax. Again, deep breath. And blow it out. Relax your whole body. There you go. Good, good, good. Perfect. Okay. This leg is going to be straight. We're going across. Let me know when you start feeling tight. You feel tight already? Mm-hmm. Okay. Take a deep breath for me. Blow it out. Good. Again, deep breath. Out. Good, 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 good. One more time. Deep breath. And blow it out. Perfect. Good. Okay. All right. All right. I want you to relax, okay? Mm-hmm. Deep breath. Relax. That side is tight too. Again, deep breath. And relax for me. Good. One more time. Deep breath. There you go. Relax your body. Relax. Perfect. Good. Take a deep breath for me. Blow it out. Good. Again. Out. Good. One more time. Out. Perfect. Okay, that's good. Deep breath. Out. Good. Again, one more time. Breath. Perfect, perfect, perfect. One last time for me. And out. There you go. Nice. Good. So, remember the key. Just relax your whole body. Don't tense up. I can feel you tensing up a little bit. I want you to just relax. Take a deep breath for me. And blow it out. Good. Let's do that again. Out. Good. Let's go to the other side. Deep breath. Blow it out. Nice. Again. Blow it out. There you go. Perfect, perfect. Okay, good. All right. Come across your arms. So we're going to stretch that trapezius muscle. Now it's basically neck and shoulders because the trapezius is being stretched, even the SCM, the levator scap. So a lot of the posterior muscles of the neck, with that stretch, it kind of gets everything too. All right, so just relax for me. And we're going to this side now. You're gonna feel tightness right in here. When you feel it, let me know. You feel it already?
That's pulling.
It's pulling, yeah. Because you're not used to stretching that particular part. Take a deep breath. Blow it out. Good. Do that again. Deep breath. Out. Good, 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 good. One more time. Deep breath. And out. Perfect. Let's go to this side now. Deep breath. Out. One more time for me. Deep breath. Blow it out. Let's do that again. Deep breath. Blow it out. Okay. All right. So one more thing before we get started the adjustments. Okay, I'm going to have you on your stomach, so you'll be face down. And I'll use a tool to kind of loosen that muscle up, this area right here. Okay, so let's have you face down. So it was mainly that left side, right? So this side here. All right, if this gets uncomfortable, you let me know, okay? Is that okay? If it's too tight, let me know. That's okay?
Mm-hmm.
I know the left side is the main issue.
I feel a lot of pressure when you go down.
Down the back? Yeah.
And that's on both sides. Right there, too.
Alright, so just tell me how do you feel? I know it's probably gonna feel a little tight because we're pressing on that muscle to kind of loosen it up. Let's have you do that motion on both sides for me.
That's better.
That's a little bit better? Okay, good.
But it's still
sore, of course. We're gonna get you adjusted. After the adjustment, then we'll do some more work with hand massages and getting some of that those trigger points and loosen up that muscle even more, okay?
Okay.
All right, so I want to check your head and neck range of motion again. All right, let's check that motion. I know basically that extension, some tightness with that, flexion, couldn't go far. So basically all your motion, all planes, lateral flexion, rotations a bit restricted. All right, so just do a circular motion with your neck for me. So kind of like this motion. So it's a bit locked up.
Hurt.
Okay.
I'm just popping.
Need some popping. So the first part we're targeting is your occiput and the upper cervical. So this is the back of your head. This is your back. This is your front. This part is called occiput. And the cervical spine, it starts at C1, 1, 2, 3, and it goes down to 7. So that motion, lateral flexion, rotation, flexion, extension, those are a bit restricted. We want to create more motion and create joint mobility, okay? So after the adjustment, we'll do the motions again, and you let me know how you feel, all right? Okay, so for this adjustment, I'm actually going to be on top of the table. I'm going to bring the table down. Good. And I'm going to have you shift just a little bit, about an inch to the left, right there. Perfect. Let's have you slide forward about maybe 3 or 4 inches. Okay. A little bit more forward, maybe about an inch. Perfect. Are you comfortable? You're not falling off the table or nothing, are you? All right. Now, the key to any adjustment is to relax as much as you can, okay? All right. So, what we talked about is that occiput, C1, C2 area. So that's the area we want to get. So I'm targeting the occiput. I am putting your head in some slight rotation. See, you're locked up already. Drop your head in the palm of my hand for me. There you go. Good. There you go. Good relaxation. Good. Relax. Relax, relax. There it is. There it is.
I wasn't expecting that.
Woo! Yes, sir. Yes, sir. All right. So now we're targeting the other side, but I'm going to do it a different way. Okay. All right. So now this time, this side, I'm actually going down to about C2, 3. Now, just relax for me. Drop your head down. Good. Now the key, just to relax. There you go. Yes, sir.
I gotta get myself together for that.
Woo! Let's have you rotate your head and neck for me. Now you had a lot of restrictions. You might feel a little stiff still, but I'm expecting. Well, I'll let you tell me what you feel.
They can move a little bit more.
A little bit more, right?
Still on that.
On that other side. Gotcha. Okay.
Goodness.
Whew. See the difference, right? Already.
Yes.
All right. So let's palpate the upper thoracic. All right. A lot of tightness. You have a lot of, your shoulder's pretty broad and this area is real tight. So I want to try this move standing up with you to adjust this part of the thoracics. All right. Now if that doesn't work, then we'll do it a different way. Okay. So let me have you stand up. Then you can come up a little bit more. There you go. Good. Let's have you move to this side. Okay. Perfect. Both arms are coming up. You can actually move to this side. There you go. Good. Now, let me reach in. Take both of your hands and lock your fingers. Good. All right, put them on top of my hand. Now, squeeze your elbows together. Lean back, just keep squeezing your elbows. Harder, harder, harder. Yes, sir.
Oh. Was the whole part was supposed to do it? Cause I felt the pop on this side.
Yep.
Goodness gracious. Oh my God. You ain't nothing but the truth.
Cause I couldn't get it when you were on your back. So I had to do it a bit different way and add a little bit more vector and trying to get that upper thoracic and like basically so C7, T1, T2, T3. That's what you felt. You know that problem. Whew. Yes, sir. Let's have you rotate for me. Good. Rotate again. The other side. Yeah, right here. Okay. Anything in your pockets?
No.
No? Okay. So, and I'm going to position you. Good. Alright. Alright, this leg is going to be straight. And let's have you come closer to the end of the table. Come in. Perfect. Good. Now, I'm taking this leg, I'm going to traction it. Bring it all the way towards your chest. But you have to relax, okay? Relax. Good. I should be able to twist you. Good. Relax for me. Relax. There we go. Let's go to the other side. Good. Same situation. Good. Perfect. Good. Head goes right in the middle. Good. And this leg, we're bringing it up, traction it. Good. What I want you to do is relax for me. Yep, felt that pop, a little bit of pop in there, huh? There we go. Good, perfect. Okay, good. All right, come up for me. Good. All right. All right, so I'm gonna have you do the ranges of motion for me again. Now, what we're gonna do though, you're going to do electrical muscle stimulation for your upper, mid, lower back, okay? Then after that, they're going to do hand massages. Because right in here, your erectors, lumbar erectors are still pretty tight, okay? All right, come up for me. Let's do all the ranges of motion. So let's have you do the head and neck rotation for me.
I can move a little bit more.
That's pretty good.
A whole lot more.
A lot more. Good, good. Let's have you do this motion.
Way much better.
Way better, right?
Way better.
Compared to before, right?
Because I can only go but so far.
Right. And let's have you go side to side. Good. Good. And let's have you bend and try and touch both feet for me. There you go. That's good. You notice that? You're touching your toes.
Because I couldn't do it at first.
Right, right. All right, let's have you extend and go back. Good. All right, perfect. Okay, all right, so now we're going to the back and they're going to do even more treatment for you, okay?
Okay.
All right.